So today we're going to discuss about fundamentals of nursing. So first we're going to discuss about triage. The triage means is a process of prioritizing patients, especially in emergency room, disaster areas and military setup. The first number is 1. That's prioritizing color is red and the immediate or emergency. The description, the red is indicating the patient is life in imminent danger and required immediate treatment. The second priority is going to yellow. The yellow is delayed. The delayed means the life is not in immediate danger but requires urgent, not immediate medical care. The third one is green, minimal. Description is minor injuries that will eventually require treatment. No priority, the color code is black, expected or death. Description, injuries are too extensive to be treated with available resources. The next one is biomedical waste management. In biomedical waste management, the waste that are generated during diagnostic procedures, treatment or immunization of human beings or animal or in research. The classification about the waste, the first classification category is infectious, then pathological, sharps, pharmaceuticals, genotoxic, chemicals, high content of metals, pressured containers and radioactive waste. So the effect of this biomedical waste causing air pollution, water and land pollution. Waste segregation. The segregation of solid biomedical waste. There is two categories of waste, non-infected waste and infected waste. In non-infected waste, that including cytotoxic drugs and chemical waste, container color is black color. The waste treatment method is disposal and secured landfilling. We are doing chemical treatment for that particular waste. The next one is infected waste category, that including 4 containers, red, yellow, blue and white container. In first one is red and that including solid waste, infected dressings and pop cast, autoclaving and deep burial. Then anatomical waste including placenta, pathological waste and body parts. That container color is yellow. That treatment aspect is deep burial. And next one is infected plastics like syringes, gloves and plastic beads. Blue container. The treatment method is recycling. The next is sharpness, sharp needles and cut glasses. The container color is white. Sharp bits are using for the treatment of waste. The steps in management of biomedical waste. First of all, survey of waste generated. Then segregation of hospital waste. What are the waste is generated from the hospital, that should segregating. Then after that, collect the waste and categorizing the waste according to infected waste and non-infected waste. In infected waste, the red, blue, white, yellow. Then storage of waste. Don't keep any biomedical waste beyond 48 hours. And then transportation of waste by the image. Then treatment waste. These are the steps of the management of biomedical waste. The next one is disaster management cycle. In disaster management cycle, there is 4 phases: mitigation, preparedness, response and recovery. In mitigation, this phase is focused on long-term actions to reduce the impact of future disasters. It involving identifying and analyzing the risk and implementing measures to reduce the vulnerability and preventing or minimizing the effect of disaster. For example, we have to provide the public awareness classes and land use plannings and all. These are the mitigation. The next is preparation or the preparedness. This phase is involved planning, training and resource mobilization to enhance a community ability to respond to a particular disaster. If it is tsunami, landsliding, etc. It includes developing emergency plans, conducting drills, stockpiling supplies, and establishing communication system and all. So next is one is response. Now response, its phase is encompasses the immediate action take during and immediately after a disaster to save life, protect property, and provide essential services. It include search and rescue and emergency medical care, evacuation of the victims, and the provision of shelters and basic necessities. So this is the response phase. The next one is recovery phase. In recovery phase, that focus on long-term effort to restore a community to its pre-disaster state or even better. So we have to rehabilitate the victim. It involved rebuilding infrastructure and restoring the livelihoods and providing mental health support and addressing long-term social and economic impacts of the victims. So this is the disaster management. The next, in detail, in disaster management, organizing and directing resources to cope with a disaster. It mainly involving, previously we are discussing that 4 phases: preparedness phase, mitigation, response and recovery. The preparedness is identifying potential health hazards and vulnerabilities. In mitigation, reduce the impact of disaster emergencies. And response is providing care to victims and recovery, support recovery after disaster. In blood transfusion, the next is blood transfusion. In blood transfusion, the transfusion of a whole blood or a blood component such as blood cells and plasma. This is blood transfusion, and the types of components like FFP, fresh frozen plasma, whole blood, autologous red blood cells, albumin and plasma proteins, platelet clotting factors, and cryoprecipitate. The blood groups, we know that there is ABO blood grouping and RH factor. If it is RH factor is present, we can call it as RH A positive, B positive and all. If the RH factor is absent, we can call it as A negative, B negative and all. The universal donor is type O group and universal recipient type is AB. And during the blood transfusion, there is careful analysis must during the transfusion. The prior to transfuse, we should check the vital signs of the patient and blood identification. We should identify the patient correctly. After that, we should identify the blood, identification of blood. During the flow rate, the 5 to 10 ml for first 30 minutes. After that, document the whole process, reaction and the general conditions of the patient. If a patient having any allergic reaction, we have to document that and stop the blood transfusion and assess the general condition of the patient, especially the vital signs of the patient and all. Then complications of blood transfusion including allergic reactions, hemolytic reactions, transfusion overload, transmission of infection like hepatitis B, HIV and all. Then hypothermia. Others including fever, chills, rashes, chest and lower back pain, dark urine and shortness of breath and heart failure. So next is preoperative complications. In preoperative complications, all patient we can see that anxiety related to the procedure, planned procedure, and nausea and gastritis due to NPO, irritative and allergic reactions in some medications and all. Then reaction corneal. The corneal reaction means especially corneal reaction, we can see the patient having any have to plan any ophthalmic surgeries and all, usually refer to the presence of a corneal edema or other abnormalities. This is the preoperative complication. The next is perioperative complications including hypotension, especially that caused by the blood loss and mismatched blood transfusion, and raised blood pressure, use ketamines, uncontrolled hypotension, pheochromocytoma. The pheochromocytoma means the hormone secreting tumor that can occur in the adrenal gland. The next is hypoxia, decreasing O2, inadequate blood flow, inadequate alveolar ventilation. Postoperative complications including pain, bleeding, wound infection, deep vein thrombosis, pulmonary embolism, urinary retention, reaction to anesthesia. Others including AKI, acute kidney injury, GI complications, anemia, fever, delirium, shock, pneumonia, wound, dehiscence. The next is burns. The burns means is damage of skin due to heat, electricity, chemicals, frictions or radiation. The types of burns according to the depth. We can tell that first degree, second degree and third degree burns. In minor burns management is cool water or dressing. And severe burn management is hospitalization, hydration, pain medication, airway breathing circulation, possibly surgery or skin grafting, and complications including infection, scarring, contracture, and psychological trauma. The rule of 9, one of the method of measuring the body surface area of burns. The head and neck is 9%, chest and upper back is 9% in each, arm 9% in each, abdomen and lower back 9% in each, genital area 1%, leg 18%. So next is fluid replacement in burns. We are using Parkland formula. In Parkland formula, there is 4 ml into total body surface area in percentage into weight in kg. There is we should give half of the solution for the first 8 hours, then given the other half of the solution for the next 16 hours. This is the fluid replacement in Parkland. Thank you.